Well, doctors and administrators at hospitals here in our area say they need your help to continue to provide the best care for the community. And it starts with carefully considering when to go to the emergency room.
Yeah, our Desmond Matthews talks with an emergency room doctor at Baptist Golden Triangle about how you can help reduce the load in the healthcare system. He joins us now live in the studio. Desmond.
Chest pains and shortness of breath are just a couple of cases where you need an emergency room. If your condition isn't as life-threatening, doctors encourage you to seek help at your local doctor or urgent care facility.
Like many hospitals across the country, Baptist Memorial Hospital is juggling an increase in patients. From COVID to other critical care needs, doctors and nurses are treating more patients and trying to manage the staff to accommodate the increase. The patient load in the emergency room has increased significantly.
Our volume's gone up tremendously over the last 2 months. So, we're still seeing everybody. We're still going to see everybody for emergencies and anybody that comes in. But, if the public could just, try to come out for mainly the medical emergencies that they're having.
Dr. Clifton Scott is an ER physician for the hospital. He says the hospital will treat all patients, but emergency cases like suspected heart attacks and strokes should come to the ER, while less life-threatening issues can be discussed in an office visit.
If you have a primary care doctor, try to call the primary care physician. A lot of times there's after-hour lines that you can call to determine, what your condition is and whether or not you need to come to the ER.
Dr. Scott says some people are hesitant to come to the ER because of their concern about contracting COVID-19. He doesn't want fear to keep people from getting the care they need.
To encourage people to, not be concerned about getting COVID here in the hospital. We are doing our best to separate COVID patients away from non-COVID patients at triage.
Hospital employees don't want to stop anyone from coming and being taken care of, whether it's urgent or just testing. The Baptist Medical Group will be offering a drive-through testing site for anyone that feels that they should be tested starting on August the 16th. But patients must call the number below to be pre-registered or the process will be prolonged.